growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here. Welcome again to the Lionhearted Dental Podcast. We are winding down the year, friends. I don't know how many weeks we have left, but I know we're getting closer to 2022, which makes me want to give you some training tips to get your mind in preparation mode for 2022. So that's what I'm going to do tonight with the podcast. But I do want to tell you one housekeeping item. I looked yesterday, and I'm talking to you right now in early December, and I already have half of my March and April implant and live surgery, surgical extraction and grafting courses are sold and committed. So it literally means I have 4 spots left in each. And look, I feel weird when I do this on a podcast because I don't want anybody ever to say that I sell them a lot of stuff. I don't think you can say that about me. But I really like to meet you if you have an interest in surgery. If you don't have an interest in surgery, then stay tuned for my plans for, I hope, on 2022. It would have to already be in probably the late spring, for sure, which would be a compilation of what we talk about. I mean, how to put together and maximize your journey in our profession, whether you are an associate indefinitely, whether you're about to embark on your own business and hence, open up an office. I don't know, even if you're public service or in traditional organized healthcare, like in a hospital or something. I believe the Lionhearted principles break through to all those venues and can help you really enjoy a better career. At least I hope they can. That's my goal. So this is a weird thing probably for some of you to hear me talk about. And it won't take that long tonight. And it's called The Secrets of Staying on Time. Now, before you turn me off, let me tell you what I used to do. I used to show up to work exactly or 3 minutes before the patient was due. I still do sometimes. I used to, but I still do too. That's a joke by Mitch Hedberg. Look him up, he's pretty funny. The best way, if you feel that each day sometimes for a long period of time, weeks, months of a given year, spirals like out of control, you're just always late. One thing I did a long time ago that I do a great majority of the time is I get to the office 30 minutes before I have to do anything to get all those things that you do have to do to have a productive day and week and career. And some of them have nothing to do with what goes on in the operatory. And hence is the problem. The problem is we all, I don't know if it's subconscious because what we do is so hard, but we allow ourselves often to be interrupted. And it's a bad habit. And I did it for years and years. So here's how not to do that. And I'm not an early bird, as you may have heard me tell you before. I'm not, man. I know a lot of you guys start at 7 in the morning or, not me. That's not happening over here. I start at 9. But I'm saying to you, if you start at 8 or 8:30 or 9, get there 30 minutes before. And here's what that time is for. Number one, for me, was lab calls. Calling my laboratories to explain the innuendos of a case. And it's really easy not to get in that habit, isn't it? I mean, how many quality doctors right now are listening that really don't do diligence to the lab relationship that you have. You need to do more, is what I'm saying. Do you know that on every lab slip I do, I type it? I do. I don't write some scribbly scrabble. I send abundant photographs for my work. And the very first thing I do with every case, which is not really on point here, is I take photographs and, of course, register of my occlusion before I start. Just listen to me. Did you ever get to a case at an insert and you noticed somewhat of an anterior open bite and you weren't sure if it was there before? Ever do that? I've done that. Now, that may be the product of the fact I do too many cases, but it's been a long time since I do that because all I got to do is go to a record, a pre-op photograph, and all the photographs, of course, in my computer top, and of course, lots of the photographs, all of them are in the charts and in the computers. So that's how I recommend you communicate with your labs. And you should really get to know your primary lab team. And you should have a call with that lab so that you know who's the head of the ceramic department, you know who's the head of the implants, and they really get to know your perks. I don't even use any lab's lab slip. And I use probably 10 different labs. I do. I have a lab for aesthetics. I have a lab for my bar overdentures. I'll be glad to share any of these with you. I got to tell you, I pay a pretty penny for high-end lab work, and it makes a difference. I have tried over the years to save money, to be quite honest with you. Here's the thing with labs. This is not the case for all of us. Most of us have 3 labs, right? You have a lab for high-end work in the aesthetic zone. Now, how high that is, I don't know for you. How willing are you to, how much are you willing to pay for a single unit in the aesthetic zone? I mean, you can get crazy. I called a lab 2 years ago in Chicago. I'm sure they're amazing, but their fees were so off the chart for my population that I did not end up using them. That's me talking to you. And I certainly probably could afford to use any lab in the country that I wanted. I could probably get my patients to pay more. I think you have to strike the right balance over your career with your area. That doesn't mean you have to be the most inexpensive. I am the opposite of that. And I think Lionhearted dentists who do it all right probably should follow my model. So here was my thing about that. I'm doing a Steve Rasner thing with you tonight. I didn't mean to get off on this first point about coming in early and making lab calls, but I'm going to expound on it because I feel like it's relevant right now. Here's the thing about your fees. If you charge, I used to say this in my live lectures, if we take 2 of you and me, and my crown fee is $2,000, which it is, and your crown fee is middle of the road, $1,400, and there's another guy listening and he's $800. Here's the problem with that. The problem is that your patients pretty much, almost 100% of them, think even the $800 per crown is expensive. They think it's high. So if the $800 crown is high, because it's this little thing, people can't relate to the work we do, patients can't relate to the years that go into everything you and I do to make our full coverage restorations stand out from the rest of the dentist nearby. So they think 800, 900 is a lot. They certainly think 1,400 is a lot, and 100% believe that 2,000 is a lot. And it is. And I really drew the line on that 10 years ago, 8 years ago. But if the $800 crown is high to the patient and the $2,000 crown is high, we're both high. So we may as well be my high. I think you need to not lowball your high-end services if you've earned it. I mean, I'm not the guy doing crown preps in 60 seconds. There's a course on that, by the way. I am the guy that's using a brownie point to polish my margins. I am the guy paying attention to my tissue, i.e. Bill Strupp and Mike Brum and many, many other fine dentists. So I am the one that cares about the fit of the provisional. I am the one communicating with the lab, as I just indicated to you. So maybe we just have a whole other discussion on fees, but that's what I wanted to say early on. Another thing you're going to do when you come in early is you're going to do your referral calls. If you're doing that to your orthodontist, to your endodontist, is it a retreatment? Is it a potentially cracked root? You just can't tell. You don't have a microscope in your office. I don't, by the way. And you're not sure. I don't hesitate for a second. In my numbers that you've heard me give you over these last 3 years, I really don't do ortho anymore. I did orthodontic extrusion to attain more tooth structure as in a ferrule over the years, but I haven't even done that in recent years. And I don't even do liners or Invisalign or any of that. And I'm certainly know many successful dentists in this country that have capitalized on that like I've capitalized on surgical dentistry. So there's certainly nothing wrong with that. But you better be outstanding on whatever specialty you're taking under your umbrella. That's really my opinion. There's no need for you to do it if you're going to just be average. So referral calls, it's a good time. And that 30 minutes can just fly. Colleague calls. It's so easy for you and I to become isolated in the profession we chose for months, for years, to not pick up the phone and stay in touch. I don't care if they are there or not when you call. The fact that you reach out to people that are significant in your life, this is a good time to do it early in the morning. Good deed calls. Good deed calls are that you heard me say in earlier podcast that each week I am expected of myself to do 4 things for patients that have nothing to do with anything but reaffirming the relationship-based practice that you hear me preach about. Well, that doesn't come from just thinking about it, guys. It comes from you doing acts of kindness, acts of relationship building. Often it can be just a card to somebody that I am instructed by my manager because that's one of her functions, to know illnesses, losses of loved ones, congratulations in order, those things. It would never happen. And if I'm doing that, let's say I do it 3 times a week, not even 4 days, not even once a day, 3 out of my 4 days. The net result of that is 3 times 4 a week, a month, is 12 acts times 12 months. That's 140 something, 44, I think, a year. That's a lot of goodwill, my friends. And I got to tell you something. Every time you do something like that, you can feel it in your heart. You can. It's palpable. And it's part, in my opinion, of this model you tune in for once a week. So my good deed calls are beyond a card. They're a phone call I make. Maybe it's an old colleague of mine that doesn't feel good anymore or has cancer or something like that. Or maybe it's just checking up on somebody. But I think it's very easy if you don't make this kind of time. to let months turn into years and just be mediocre in life as a friend, be mediocre in life as a colleague. Who wants to do that? And the last thing I will tell you that it's good for is to review your goal list. And I haven't made a big deal on these podcasts about goals. I'm going to tell you something. It may sound corny. I don't know what the science really says about goals. I know it's something like only 3% of the population has goals and only 1% writes their goals. They help me immensely. And I kept my goals to a maximum of 1 year. That's me. If you read, there's just a bounty, a plethora of books on goal setting. And they'll confuse you at times. You got to do what works for you. And I like to go out a year, and it just works. And you should be doing it, by the way, right now for next year. You want to add a hygienist 1 day or 2 or 3 days. Maybe I have one hygienist right now. I don't want to get too sidetracked, but I'll never forget I had one hygienist for many years. And I remember talking to Michelle one day and saying, why don't we have two? Now, we didn't really have the need for two. We were fine with one. There wasn't a real backup list. I just made a new goal. I said, okay, let's do it. So we set out. Now, the hardest part of that is hiring somebody that wants to work 1 day a week. Because when we add a day, the way we did it is we gave ourselves 3 months. That's a lot of time to add 1 day. So we used to have 4 days a week. Back then, I think I worked 5 days a week, which is a bad idea. And then I added 1 day. And then every 90 days, I added a second day to that new goal list. By the way, I have 6 hygienists, 6 or 7. I can't keep track. Not all at one time, not all at one office. So this is a very important one to my younger colleagues that have had their own office for less than 5 years. You may find yourself, right, with not enough time because you're doing, and I so get this, you may be doing an implant here, right? A nice crown and bridge case like I'm doing tomorrow. I don't know, 8, 10 units of crown and bridge. And then you're doing a distal buckle on number 31. Boy, that's real productive and real lucrative for you, isn't it? Or worse, it's probably number 15 and you're right-handed. Right? You feel me? You know I live in your world. I've always told you that. So you early on, earlier than I did, should start focusing and having goals on what you don't want to do. I did hygiene for a year. It's okay to begin with whatever you have to begin with. But as you evolve, why not get an associate? That's not demeaning to an associate. I was an associate. You were an associate. Some of you are right now. So as you get your own practices or your skill set develops and to do more productive dental procedures, you need to eliminate yourself from doing, unless you love doing those wonderful buccal restorations or whatever. So that would be a goal if I was you. And I certainly would have personal goals added to that. And the best time of the day to review your goals, and mine would be yearly, monthly, and weekly. So the weekly goals led up to monthly goals. And the monthly goals led up to quarterly goals. And then the quarterly goals would be in sync with my yearly goal. For me, it'd be publishing an article. I already started my 2022 article, at least one. I'm working on this course I told you guys about, the live Lionhearted weekend. It makes your life interesting. And by the way, you have to treatment plan your personal goals as well. Vacations, your CE, time with your loved ones. I mean, you'll never get that back. So let me just look at one thing I wanted to say to you. We'll leave you with this tonight. This was a slide from the presentation I did last weekend in Florida. And it said, when you really make the commitment to comprehensive treatment planning, different subject, guys. When you truly make that commitment that you're going to set aside the proper time, for me, it's only 60 minutes, and that's of my time. I want to leave you with this slide for this week, even though it's not on topic. It's a slide I showed last week in my presentation in Florida. When you really make the commitment to comprehensive treatment planning, you give yourself the ample time that you need. You look at the 5 arenas of the mouth on every patient, unless it's a teenager, that I've talked about in an earlier podcast, then you will find a need to work with colleagues that are more efficient and predictable than yourself. My endodontist could do a molar endo in less than an hour with astonishing results. Now, I'm sure there's several of you that may be able to echo that. I can't. And it doesn't have any skin off my back. And you may say, well, why don't you have one in your office? And I guess right now, in the last 5 years, it's not my priority. You know what does feel good? It does feel good putting a crown on a root canal that is astonishingly perfect. That feels good. As opposed to one with one of the canals looked a little too short to me, or one of them looks too long. And even perio. I will have to look you in the eye tonight and say, I do really good free gingival grafts. My root coverage connective tissue grafts aren't as strong. And I struggle with it. I'm not telling you not to venture out, because you may end up being way better than I was. And then you should do it, and you shouldn't refer. My point is that when you really commit to addressing every mouth comprehensively, whether the patient accepts it or not, so many patients will accept that approach by you, that you won't have the time, don't get mad at me for this, to take a course in Botox. You won't have, or lip fillers. You won't have time to even want to do some procedures that are semi-predictable in your hands. And it makes the whole outcome and product, that is your dentistry, better. You know what one of the biggest payoffs to following these Lionhearted principles? I'll tell you what it is. It's one you haven't thought of. It's when you go in for a hygiene recall check. And this is going to happen to many of you this year. I want you to remember me saying this to you tonight. And you look at work that you forgot that you even did. Either you did the endo because you're magnificent at it, or you sent it out to do, or you have your own endodontist. Or maybe you lined up the teeth better with orthodontics because you did it right prior to doing the veneers. So you got all the spacing correct. You didn't just skip that step to get the case, right? And of course, in both of the preceding examples, the soft tissue is just esteemed. It's beautiful because you follow our principles, that's numero uno in anything we do. And when you look at that and forget that you even did that case, it validates the whole thing. I'm not kidding you. And that doesn't always happen. Sometimes we walk into a room and just the opposite happens. Oh my God, what was I thinking? It's okay. It's part of being a good dentist. Part of being an elite athlete is not always having a great day or a great performance. But you got to be honest about it and shoot for better. I hope this helped you guys. God, I'm looking forward to meeting some of you. Hope I meet you this year in my surgical courses, or hopefully I'll get a little more active here and get the Lionhearted weekend together. Have a great day. Have a great week. See you next week on the Lionhearted, guys. Take care.